Hi, I'm Carrie Elizabeth Lynn. I'm a licensed professional counselor and I also have bipolar disorder myself. Today I'll be explaining the symptoms of a manic episode. So, a diagnosis of a manic episode requires a few things. First, there has to be a distinct period of abnormally and persistently elevated, expansive, or irritable mood and increased goal directed activity or energy. These changes in behavior have to be present most of the day, nearly every day, and they have to last at least 1 week or any length of time if hospitalization is necessary. Second, there have to be a certain kind and number of symptoms during that period. So there have to be at least 3 of the following symptoms to a significant degree and representing a noticeable change from usual behavior. Or if the mood is only irritable, not elevated or expansive, there have to be at least 4 of these. Number 1, inflated self-esteem or grandiosity. Number 2, a decreased need for sleep. 3, being more talkative than usual or experiencing a pressure to keep talking. 4, flight of ideas, which is where your thoughts rapidly shift from topic to topic, or a subjective experience that your thoughts are racing. Number 5, distractibility. Number 6, an increase in goal-directed activity. For example, at work, at school, in your social life, or sexually. Or psychomotor agitation, which is where you're extremely restless, so you make unintentional movements like pacing or wringing your hands. And finally, 7, excessive involvement in activities that have a high potential for painful consequences. For example, going on buying sprees, getting involved in risky sexual situations, or making foolish business decisions. Third, the symptoms have to be severe enough to cause a marked impairment in life functioning or require hospitalization to prevent harm to yourself or others, or involve symptoms of psychosis. In other words, mania is a serious medical issue that involves significant changes in how the brain functions. And finally, the episode cannot be due to the effects of a substance or another medical condition. So those are the symptoms required for a diagnosis of a manic episode, though they certainly aren't the only ones you can experience. I'll be describing these symptoms in more detail in future videos in the series called Speaking of Symptoms. Thanks for watching, and here's to good mental health.